Hi, everyone. Welcome back to another episode of Heart to Heart. As you know, this is our series with Dr. Amri Mohammed and myself, Dr. Amisha Gupta, where we talk to today's physicians about their journeys in medicine, how they got involved in social media, and what really matters to them as people. So today, we are super excited to have our friend, Dr. Anita Patel. So Dr. Patel received her MD from the University of Virginia and went on to train in pediatrics at New York Presbyterian/Weill Cornell and completed her fellowship in Pediatric Critical Care at Columbia University. So she's dual board certified and presently an assistant professor at Children's National. She's also an NIH Physician Scientist. She has a wonderful reach on social media on her platforms where she's a strong advocate for moms, physicians, and self-care in healthcare. So Anita, thank you so much for joining us today.
Well, that was such a nice introduction. Thank you very much.
Of course, we're so excited, and so we like to ask all of our guests the first question of why medicine and how is your journey yours and why did you become a pediatric intensivist?
So the why medicine piece is pretty simple. I actually didn't have many doctors in my family. I'm an only child, so my parents are not physicians. And I finally have one cousin who's a doctor. So I didn't come from, like sort of an inbred doctor family. Although I love when people say that because I think it's so cool. But my story was really, as far back as I can remember, I loved going to the doctor, and I still remember my pediatrician's name. It was Dr. Schweitzel, and he just he was just the best. And as far as I can, long back as I can remember, I used to wear pearls to go see him. I just thought he was the coolest. Fake pearls. I just thought he was the coolest person. And as I progressed, I realized I loved science, absolutely love science. And not only did I love it, but I just had a natural inclination towards my science and math classes. And I think it's, not a lot of people talk about this part, but in general, we often like the things that we're also good at, right? So, I hate to say it like that, but it's the truth. I had a natural sort of knack for science and math, and I also really liked it. So that was my early foray into thinking I wanted to be a physician. And, I kind of knew early on, I was lucky to go to a high school that had this thing called a co-curriculum. So one day a week we weren't in the classroom. We actually did a volunteer or internship. So which was really interesting. And so I volunteered at hospitals for 2 years, and then I volunteered at the NIH actually for 1 full year. And I really, really, really enjoyed being in the hospital. I loved being with patients. I loved following doctors around. And I really enjoyed my time at the NIH, but I did sort of, I loved the science part of it. And I liked that I was able to go to the clinical center and see patients and see how the clinical trials were being applied to the patients, but I was doing basic science and I didn't love being in the lab. Now, I didn't write off basic science still. In undergrad, I ended up majoring in neuroscience, and I did my honors thesis in a basic science neuroscience lab. And I was doing the pipetting and these crazy 7-day protocols. And, I ended up completing the work and I published it. But I will say on my last day, my mentor and even the lab tech, the lab manager was like, "You're not going to do basic science." I was like, hell no. I was like, this is not for me. So I needed to be with people, and it just wasn't for me. So I ended up in undergrad. Then once I finished my thesis, I ended up working in clinical trials, directly applying, doing clinical studies on patients in obesity research. And I loved it. I absolutely loved it. So I ended up taking a year off before med school, and I continued working there and just fell in love. I felt like it was cool to like see how the science was actually, because I did behavioral modification protocols, so you could like see how the science was actually improving, or in some cases not improving, patients' lives. So that really sort of solidified, number one, that I very much wanted to be a doctor, and that I very much thought I wanted to do research. And I say thought because I think we all kind of think we want to do research early on, because that's what we think. Like, well, maybe not all, but like, I feel like in this way, it's ingrained in so many, like let me say it this way. We think we need to do research. How about that?
Yeah.
That's a sort of better way of saying it. When we're getting into med school, they say, oh, you need to do research to get into med school. When you're in med school, they say, oh, you need to do research to get into residency. When you're in residency, oh, you need to do research to get into fellowship. And I think that's important because I personally, for the first time at the end of my fellowship, actually took a pause and was like, do I actually like this, or am I just doing it because I happen to seem to be okay at it? And I had some sort of early success in my residency and fellowship projects. So I was like, do I like it just because I'm having success, or do I like it because I like it? And do I just like it because I know I can get a job this way? So I just say that because I don't want anyone to like look at my social media or the social media of any researchers and think that like we're all 100% sure that this is what we want to do. Yeah. I wasn't, and frankly, I mean, I'll talk about this even more. Like I even to this day sometimes have questions, much less than I used to. But anyway, so that was kind of my path to medicine and medical research. Pediatrics actually was not in my plans. In fact, I always say this, like I scheduled my pediatrics rotation first because I was like, let me be with the nice people first. And then I wanted to do surgery. So I scheduled surgery last. And it was very obvious within a couple days into my rotation that like these were my people and this is what I wanted to do. I knew I could not do general pediatrics. I was like, I hats off to general pediatricians, but it just wasn't for me. And I really don't like clinic either. So I know you guys often have to do it. So or you don't, depending on what you do. But yeah, I knew I didn't want to do clinic. And then when it came to subspecialties, I actually applied to HEMONC fellowship initially. So at Cornell, you do your HEMONC rotations at Memorial Sloan Kettering. And we don't get to see, you don't do pediatric ICU until your second year in most institutions. So I realize now in retrospect, I fell in love with HEMONC for two reasons. Number one, they were sort of the more sick patients that I was exposed to. And HEMONC, Memorial Sloan Kettering in particular, like they do pressors on the floor there. Like they're very different institution, and a wonderful institution, frankly. And also I loved like how you were there for patients at their sort of hardest time in their lives, and you either were their shepherd or their guide into getting better, or their shepherd into giving them a dignified end of life. And although it was difficult, I realized I really liked being that person. Flash forward, luckily my program director knew me better than I did and scheduled PICU first. And halfway through my PICU rotation, I was like, oh my God, I think I want to do this. And, I cried in her office for like weeks on end, making this decision. Then I had to go tell Sloan, like, hey, I actually want to do PICU. It was a big thing, but it was fine. And I made the right decision. And that's how I ended up choosing PICU. And I love it because you get to do procedures, but you also get to do like medicine and use your brain. And it's just perfect. And also when you're there, you're there. And when you're not there, you're not there. Like I don't have continuity patients, although I feel like I do because there's so many frequent flyers who I love and I feel like they are my patients. But it's, you're on when you're on and you're off when you're off. And that works really well for me. So that's a very long-winded answer. I apologize.
No, honestly, we love hearing like all of the details, and I think our audience does too, because it just shows like all the different facets of why people become physicians. And there's so many different types of physicians. There's so many different reasons. Obviously, there's a lot of similarities between us all because we all went into the field of medicine. But, you know, all of these details and nuances in our paths, I think is really enlightening, I think, for people, because it shows that, you know, maybe somebody else thinks like us or look at how they were exposed to something. And, you know, a couple things about your journey that I thought was really cool, besides everything about it, was in particular one that your high school was quite progressive, you know, and allowing you to do those type of early rotations, because I think it's so hard for so many of us to decide, right? And even to this day, right? We're adults, we're all attendings, and we evolve, right? We change our minds, we change our decisions. Totally. And so to expect that as a teenager to know exactly what you want to do in life, I think is such a big, daunting task. And so for your high school to provide that type of opportunity, I think is amazing. And hopefully more schools can kind of do that, and more colleges as well. And the other thing was just, you know, the people, a couple people that you mentioned that had big impact on you, right? So of course your pediatrician, and then, you know, you said your program director as well. And I think, you know, having individuals in our lives that we don't always know might turn out to be the ones who are kind of the most important inspirations, I think is key to our future in medicine, because I think it shows how exposure really can help change somebody's perspective. So I love hearing about your journey.
Totally. Yeah, no, you're spot on. Absolutely.
Yeah, and I will just jump in here and say that not every physician loves research.
Totally. Yeah. No.
Yeah. But this is going to lead to my next question, because obviously research is a huge part of medicine. And what I loved that you highlighted in your initial, answer to our question about your journey through medicine is how you were able to be a part of the clinical trials, right? Because a lot of, you know, our guidelines and management for our patients are based on clinical trials, right?
Absolutely. Yeah.
So, you know, you've told us that, you know, you've told us a little bit about how you got involved in the NIH. And so I think this is more about, you know, being a physician scientist, because I'm sure that you would agree, you know, as physicians, our basic training in research, I don't think is very good unless you have a, you know, knack for research, or, you know, you make it a part of your training or schooling early on. You really have a difficult time understanding research at the end of the day. So, you know, tell us a little bit about your experience as a physician scientist, you know, and how do you think that we can do better as physicians to understand research? And do you think that, you know, especially in schooling and in training, it should be more a part of our, you know, curriculum to be able to understand it? Because I really feel like there is a disconnect. Like, we go through all of this, and then as attendings, we're just expected to understand all of these really complex parameters that go into research. And it's extremely complex, hence why it's a totally different, you know, pathway even to go into.
I think you bring up a really good point. So yeah, I mean, I ended up doing quite a bit of research for a long time, right? So I kind of knew what it entailed, and I personally sought it out at every stage. But I agree with you. I think that there's a couple fundamental issues. So first of all, I think in both medical school and in whatever residency you choose, having more of a dedicated research curriculum, and I don't mean having to do research, because I actually have strong feelings about that as well, which I'll get into, but I mean like a research curriculum, like what goes into clinical research, what goes into lab research. And frankly, actually, now that I'm talking out loud, I think it really needs to be in medical school, right? But I do think it should continue on into residency, so then it's focused into your field. But again, I think, unfortunately, in most medical schools, unless it's changed, because let's be honest, it's been a while since I graduated. Like, unless it's changed, they kind of expect you to seek it out if you want to do it. And if you don't seek it out, then you're already at a disadvantage, like at every step of your way. I can't tell you how many fellows come up to me and are like, I feel like I'm behind. And I have to tell them, like, people start their career in fellowship. People even start their career as in attending. It's like, yes, you're in a different pool, and yes, you're going to be competing against people who have been doing it a long time, but it doesn't mean you can't be very successful. So I think that's an important point. And again, the onus is on medical schools to incorporate a research curriculum that tells them exactly what is happening. Again, as I said, I think that should be continued on into residency. Now, this is where I think it gets a little weird and wrong, because suddenly you do a fellowship, and I don't know adult fellowships, but I know pediatric fellowships, and they require you, and in fact, over half of your time is dedicated to a research project. Now, for someone like me, that makes perfect sense, right? I want to do research. I want a research career. So that didn't bother me. I went to fellowship at Columbia with my co-fellow, one of my closest friends, and he did not want to do research. And he struggled for a year and a half to like force a project that he never ended up, I mean, it fulfilled his requirement. He never published it, and I would look at him and I was like, this is not fair. Like, why are we requiring him to suddenly in fellowship, like the terminal end of your training, to spend over half of his fellowship doing research? So there's clearly a disconnect here, right? Like, there's no required exposure. And then if you decide to do fellowship, you suddenly have to do it. And so I think, again, that there's just some issues there. And I'm saying this as a researcher. I don't think you should force people to do research. I think we should make sure we expose people, but forcing people to do research when they don't want to do it just ends up having crappy projects. And that, more importantly, that person is not happy throughout their research time. So again, the onus is on medical schools and residencies to create dedicated curriculums, if nothing else, to expose people so that maybe they'll say, hey, I actually want to do research. So they're not one of those people later on being like, now I'm behind because all these people have been doing it for a long time. And alternatively, it tells other people, hey, this is not really what I'm supposed to be doing. And yeah, I mean, for me, how my path to being a physician scientist, I did seek it out early on, but I think the thing that was all exposure in my mind. It was exposure, understanding what I liked and what I didn't like. It was really in residency. Once I decided on PICU, I looked around the PICU at sort of the different people who were doing research. And this is the weirdest part of it. I ended up choosing a research mentor that was doing a project that I initially thought I wasn't that interested in, but I actually thought she was who I wanted to be. She was a researcher. She was like the most badass PICU doctor, like just the way she would resuscitate, the way she would command a room. And she was like this tiny little woman, but she just was like, everyone respected her. She was doing phenomenal research, and she had 4 kids. In fact, she got pregnant was pregnant in the middle of our research project, and like had her baby and like left me in charge of the project. Appropriately, not like threw me in the deep end, but so that's how I chose her. And then it ended up that I actually loved the research, and it ended up, frankly, she's her and her research project are the reason why I have had success in research, because it just ended up being a great project. Even though I went to Columbia, I continued to work with her because I was like, I just want to stick with this person. And although she's not my research mentor anymore, she's very much a career mentor. I keep in touch with her. Like, whenever I need a letter, she's the person to write it. She's like put me up for talks at different institutions, so she's turned more from, I would say, from a research mentor, she's turned into a career mentor and very much a sponsor, someone who you know, she's not looking to gain anything from me. Of course, I will do anything for her if she asks, but she's just there as sort of a kindred spirit in my world that I know, you know, I mean, I have a perfect example. When I submitted my most recent grant, they told me the day after it was due, hey, you're missing a letter. So I called her up. I was like in tears, and she's like, I got you, and like wrote the letter in like 5 minutes and sent it, you know. So you need people like that in your corner. So again, I didn't actually choose her because of the content of her research. I chose her because of who she was and because she was successful at it. And that was the best decision I could ever make, because she really had a life I wanted. So it worked out. And then, you know, the rest is history. Now I'm doing not the same, I'm doing completely different type of research. And I'm also, the content is different. It builds upon what I used to do, but that's okay. And she sort of set me up on a path to success. And yeah, I mean, I'm forever in her debt. And even when as an attending, when I got to children's, I sought out the most successful researcher there. And not that I even was like, you know, he frankly scared the crap out of me. I'm going to be perfectly honest. And now he's like, I feel like he's my dad, but like, he's truly like scared the living daylights out of me, and he scares most people. But like, I just ran my ideas off of him, and ultimately he's like, let's just work together. And then, you know, the rest is history again. So I guess the whole point of this story is like, seek out the people that you admire, and start a relationship. And if that relationship rolls into a functioning working relationship, the more the better. If it doesn't, and I have experiences where it didn't, there's still people I can go to and be like, hey, what do you think of this idea? They're not my research mentor, but I still have a relationship with them. And that's how I've been at every stage. And so far it seems to have worked out. So that's what I would recommend for anybody.
Yeah, you know, I think that one of the things that you said was, you know, about distinguishing research in terms of, you know, like creating projects and doing research versus education. And I think it's so important for physicians to at least be knowledgeable on how to decipher studies, clinical work, and research, because, you know, this pandemic is a perfect example of how, you know, we're all fighting misinformation, and how we can be advocates for science and you know, progression in medical care. And so I do think, you know, it's very important that trainees understand the basics of clinical research, so that when they are attendings or residents or fellows, you know, that they can help their patients by understanding the fundamentals of projects. And so, you know, in terms of then, you know, how we want to create trainees to do research, I do think that that needs to be studied a little bit more, like you were saying, and about how to really optimize programs that way. And it's, you know, some individuals don't know they like it until they try it. So I do think those things need to be worked out. But I think the basis of research, of medical and scientific education, should be started earlier. I agree with you. You know, we get a little bit because we're required to for pre-med requirements, like take this biostat class, which then we forget, and then we have to review again before our boards. But to have a consistent curriculum in medical school that's carried on through residency and then fellowship, so that, like you mentioned, you know, we're building stronger physicians, and they're not, you know, maybe last minute kind of looking for things. And I also want to say that, you know, we talked to Gina Lundberg, who is an adult cardiologist, and her path was a little bit different, where she went into private practice and then into academic medicine, kind of mid-career or early career, and then became, you know, more involved in research. So, you know, just for our audience, you can kind of pick up things and your interests as you go. You know, there's not just one way to do it, but, you know, finding the people, like you mentioned, that you care to be like, or you want to learn from, I think is really important. But I'm going to switch a little bit of gears here. You know, we talked about work, talked about research, and your other big topic is self-care. And you talk about how yoga really helped transform the hot topic of work-life balance or work-life fit for you. So how do you think, physicians can incorporate more self-care? And do you think that should also be something that's part of like hospital systems, or, how can we get that word out in regards to self-care also being part of your own healthcare?
Yeah, no, that's a great question. So, it's funny because I feel like when I first got into social media, when I'd get asked this question, I, would talk about, first of all, I'd always say self-care doesn't have to be yoga. Just find something that, for me, it is, or exercise. Finding those things that fulfill you outside of work, and dedicating sort of discrete amounts of time that are manageable. And I think so many of us in medicine are so type A that, like, if we can't do, I'm just going to use yoga as an example. If I can't do an hour and a half of yoga, I'm not going to do it at all, right? And especially now as the mom, I've had to accept that like 20 to 30 minutes of exercise or yoga is sufficient, and not just sufficient, it's great, So when I first started doing just shorter amounts of time, I would be like, okay, this is fine. Now I'm like, woohoo, I got my 20 minutes in, that's great. And that's what I tell everyone is find what you love and incorporate it. Start at like 5 minutes, like do 5 minutes of what you love, and make sure that it's not in medicine, because we all probably, I hope, like love or like medicine, but it should be something that's not in medicine, because I just think, for me, the reason I sort of fell into yoga is because I was not just burned out. I was sort of at a precipice of just falling apart, honestly and truly. I was in the middle of my fellowship, and I don't even know how to describe it anymore. It was just, I was on a path that was not going to be sustainable, essentially, is I guess the best way to describe it. And for me, when I actually started yoga in the middle of my fellowship, I'd never done it. And then I loved it and like jumped in a month later into yoga teacher training. And the reason why I did that was, it wasn't to be a yoga teacher, but it was really to like dedicate myself to something outside of medicine that fulfilled me. And I had never, this is going to sound so sad, but like I had never done that. I felt like every step of my life was like geared towards becoming a doctor, because I loved medicine. I love it. I really, really do. So I thought, well, it's fine if all my other activities are setting me up for success in this career. So when I found yoga, I was like, this has zero to do with my job, and I love it, and I'm going to immerse myself in it. And so again, I'm not saying that you have to do that, but I do think it's important to dedicate yourself to something that you love, whether it's reading, I don't know, going on walks, whatever it is. And starting, it's like incorporating anything into your life, like start at 5 minutes a day and then increase to 10 minutes a day and then 30. And then the bigger thing is, don't beat yourself up if you don't do it one day. That's okay. Then just get back on the horse and start back at 5 minutes. So I think just incorporating practices into your life in a way that fulfills you is incredibly important. But that's sort of what I used to say, and I still very much believe that. And I just, those things that I just told you, I do to myself all the time. If I fall off the wagon with yoga and exercise, I do the same thing. I'm like, okay, I'm going to do 20 minutes today, and that's it, and then I get back on the horse. But now I actually think it goes beyond that. To number one, I think, Anisha, you mentioned like, what can we do in hospitals? I think, something else that saved me in fellowship is that my hospital offered free mental health services. And so I got plugged in, with a therapist at the time who actually is still my therapist. Like we still see each other over Zoom. but you know, as fellows, we make no money. So it was a big, she happens to be a psychiatrist, which is like unheard of that a psychiatrist is doing like therapy, but she does. There's no way I could afford her then, right? So my hospital offered 10 sessions, but then they had the option if the therapist decided that you needed more, that they would keep paying. So that service that my hospital provided was like the most functional, concrete, and helpful thing that you could have done. And I mean, I don't know if this says something about Columbia, but like every freaking fellow in my fellowship took advantage of it. So, you know, I mean, so just something as simple as that. And not just, you know, as once we're attending, yes, financial help is helpful, but what I think is even more helpful is just having a compendium of mental health practitioners, because I will tell you, one of the reasons why I still see her virtually is because I couldn't find one when I got to DC, and I'm a doctor, and I could not find one. It's like it's such a crisis of finding people, that I think just hospitals offering something like that is so helpful. And then, yes, I think, you know, it's sort of the whole, like, don't just offer us pizza, like, you know, give us actionable things like financial literacy. I still feel like I don't have, you know, before we started, I was talking about my taxes. Like, I'm now, as a 38-year-old woman, you know, trying to understand what else I can do with my money to make passive income, which I don't really do. Like, I have my 401k, I do all the standard stuff, but like, I don't know that stuff. So I think there needs to be a much more holistic way of supporting us beyond like pizza parties. And even, I actually don't even really believe in like free yoga. Yes, it's nice to offer free yoga sessions in like, you know, the lawn of your hospital, but I don't think that that should be like the end all be all. It needs to be much more pervasive, in ways that can improve our life. Like our hospital offers like emergency childcare, which I think a lot of hospitals do now, fortunately, but that's an actionable thing that for a lot of us who are parents, and especially in the pandemic, it helps our lives. And like IT support, like how many of us complain about our electronic health records and we feel just sort of dejected that it's never going to improve. Well, having support staff that can help. So like, things that can improve our daily lives, I think, are the things that we now need to be focusing on more. And I think that that has actual lasting mental health effects. Yeah. So anyways.
That, I mean, you brought up so many great points. I seriously love this discussion. I feel like we could just talk to you all day. I mean, honestly, like the fact that you said that self-care goes so far beyond, you know, just, you know, a spa day or, you know, a nice mask and a bubble bath, which we all love and would love to do every Sunday as our self-care Sunday. But, you know, that to me is like a social media, that's like a social media term, right? It's actually BS. It doesn't mean anything. That just means, okay, fine, have a couple of hours off to just, you know, relax. But actually doing things for yourself outside of work to not only take care of your physical health, but your mental health too. And thank you so much for not only acknowledging mental health, but also sharing your story as to how during your fellowship, you know, you were going through a difficult time and you were fortunate that your fellowship program, which honestly, Anita, most places don't offer this, offered you free mental health services. You know what I mean? You know, all like when I actually was in residency, my dad was going through an incredibly difficult time with a cancer diagnosis. And it hit me really hard. And I didn't have anyone to turn to, but I do remember one of my clinical supervisors saw that I was going through a really difficult time. I didn't tell anyone in my program. She pulled me aside and she said, I know something's going on. You don't have to share it with me, but I'm going to refer you to this person. I really encourage you to talk to somebody. But, you know, where did the money come out of? It came out of my own pocket. It's not like, you know, someone was helping me with that. So, you know, I think in this era of, you know, COVID, right? It's honestly, we have a lot of cracks in the seams in all sorts of different aspects of, you know, our lives in different professions, right? And especially within the profession of medicine, I think we're realizing doctors are more than just doctors. Doctors are human.
Yeah.
We have to take care of ourselves or we can't be good to our patients.
Exactly.
Burnout happens. I mean, we can't, we're talking about mental health. I mean, why is physician suicide, the rate of physician suicide so incredibly high, right?
Yeah.
I mean, and we just don't talk about these things enough because we're not as vocal about what we go through on the inside because we're expected to be put in a box and say, okay, we always have to be on point. We always have to make sure that we perform the best work at work, and no one really cares what we do on the outside. The expectations of physicians, I truly believe, and I'm sure a lot of people will say otherwise, but I truly believe the expectations of physicians above any other profession are put just on.
Oh yeah, absolutely. I mean, and I try to be very honest on my social media about like that I always say, I see a therapist and that I struggled, and I recently shared that I had postpartum depression, but I will say I get tons of messages telling me stories of people who have shared and who've like had issues at their job. So I will say that I always share, I mean, besides saying that I am seeing a therapist, because frankly, again, I just don't believe there should be any stigma around that. Like, I mean, I shared months and months and months later that about my postpartum depression because of that very thing. I was worried. I remember, I think I shared one post like when I was going through it, I didn't say what was going on, but it was very like not, saying that I was struggling. And one of my friends was telling me about one of our good friends who literally, because she shared something about having like headaches and like being stressed out, that she was getting mandated drug testing. So I'm sure we all know what the story is, and I would never say it, but like, it's just one of those things where like exactly what you said, that there's the expectations of us are not just extraordinary and wrong, but they are literally killing us. And that's why I feel strongly about sharing after the fact whenever I go through something, because if we don't share, then the students below us or the younger generation are not going to share, and it's just going to be an endless cycle. And I do think, although it's still bad, I do think it's getting better, and it won't keep improving unless we keep sharing. And that's one of the whenever I'm like, I'm going to quit social media, I'm like, no, so slow down. But it's just you're right. You hit the nail on the head. The expectations of us are to be superhuman, and we're not. None of us are.
Exactly. So. Yeah.
And I think, like you said, what I've discovered, because I think we've all, at least the three of us definitely, and, many physicians all go through these times where we just feel so alone with, the struggle or whether other difficulties in life and, the expectations that we've talked about. And what I've discovered is one of the benefits of social media is this discussion, right? Because I felt like I had to keep it inside when I was struggling. And when I saw that you and other physicians were talking about these types of things, I was like, wow, well, I'm not alone. And there's a community that understands, right? And so, like you said, I think that having these discussions will hopefully start to crack a system that needs to be changed. Yeah. And I'm, at least one of the positive things from social media is that we're able to connect in that way and share our stories. Yeah.
I totally agree. It's really you hit the nail on the head too. Like the connections are really, that's the true power of social. Like we would have never met, right? Like we would never be having this conversation, it's just, that's the power of social media, not, all the other stuff, not the follower accounts or anything like that. It's like, it's just, that's what's the amazing part of it.
Totally. And so to round out this discussion, because like I said, we could literally talk to you for ages.
It's my fault. I'm really verbose.
We love chatting, so we could go on for like an hour.
We talked to some other people, and I'm like, oh man, how are we supposed to make a video on this? Anyway, so it's a great segue. You were talking about social media, and some of your thoughts about social media. So how did you initially get started on social media? Like, what was your initial purpose for going public on social media? Because we all have a story with that. And if you were to give advice to like students and trainees, you know, because the era that we're in now is very different than the era
Oh
that
God.
we came up with. At
Yeah.
social media was such a taboo for us to even be on when it came to our career. What kind of advice would you give them to utilize social media towards their advantage to elevate their own careers?
I think that's wow, that's a great question. So my story is super funny because I, first of all, was one of those people that had, you know, we were raised in the era of social media is bad. And, you know, I remember I didn't even really have Instagram prior to being, I had Instagram prior to being an attending, but it was like private and I never posted on it. But I remember I used to shut down my Facebook like well before I was applying for any residency, fellowship, or job because I was like, and not even that there was anything bad on there, but like that's just what we were taught to do, right? Like
or to change your
name.
Yeah. Oh yeah.
So no one would find you. Yeah.
Totally. It's so funny because I can't tell you how many of my friends, like, they're like, oh, my name is blah, blah, blah on Facebook. And I'm like, huh? Yeah, but that's why. Yeah. So anyways, I ended up becoming initially more active on Instagram because when I first moved to DC, although I grew up here originally, like in the suburbs, I really only had like one friend here. I had essentially almost no friends and I was really lonely. And, you know, the way that I knew to start to make friends outside of work was like go to a yoga studio. And I just started to follow a bunch of yogis on Instagram. And then I was like doing all these yoga challenges that they were running. So I had to have a public account to do them. And so all I was posting was yoga photos. Like that was my Instagram. And I really enjoyed it. I was like, this is really fun. And then I'm sure you guys know Alok. So Alok and I knew each other pre-social media. So he was my house doc when I was a fellow at Columbia in the cardiac ICU. So, which was, I mean, we just became really fast friends. And when I left Columbia, we reconnected on social media, and he was the one that was like, dude, you need to like start to get into the medical world of Instagram. Like, you know, you can bring your yoga into it. It's going to be so powerful. So he was like my hype man being like, do this, do this. So I was like, all right. And then what really got me into now I rarely post yoga photos, right? It's just like not my thing on social media anymore for many reasons. But then when that Verify Healthcare campaign, I don't know if you guys remember it, but it was pre the Association for Healthcare and Social Media, before it was born. We did this Verify Healthcare campaign, and Alok wrote me into that. And that's when I started to do more medical posts on Instagram. And then sort of a smaller group of us were like, we need to have like a nonprofit for doctors on social media. And I just kind of went in with both feet because, again, like I didn't have a ton of friends in DC. I was starting to make more, but I just was like, sure, let me throw myself into this. And I did. And, you know, a couple years later, we have this nonprofit, and, you know, I'm on the board of that. And that's what really pushed me into the medical world. Now, as you guys probably know, you follow me, like I don't post a ton of educational posts. I do them when I feel like I have something to say, but I don't do them just for the sake of doing them. And I don't do that for a very specific reason. Social media is not my job. For most of us, it's not our job. I do feel very strongly about educating and using it, obviously during this pandemic. Like, I'm not talking about adult issues because I'm not an adult doctor, but I talk about MISC because I see that all the time. I talk about acute COVID in kids because I see that, right? So I do education and on my stories more so, but I do what my purpose really on social media, and I think the thing that really keeps me on beyond the connections is that I think the world of academia, weirdly on social media, has a really bad rap. And I feel very strongly that, yes, there are so many challenges to being a woman, like a physician, women scientist in academia. There are so many challenges. But I really do believe two things. Number one, that it can be done. And yes, you can have a family and still be a woman in academia. By the way, if there's any takeaway, I'm a mom. I'm very present in my daughter's life. Yes, there are times when I'm more busy, but I also, because of this pandemic and because I have a grant, like I am on research more of the time. So like, yes, I have to have childcare because I have to do my research, but I get to see her all the time. So, and my schedule is actually quite flexible because of research, by the way, but that's a whole nother topic. I feel like I want to be like, guys, you can do it. So that's one of my purposes on social media, is to show women that you can have an NIH grant and be a normal person who has friends, who has a husband and a family, or a wife and a family, whatever, you know, whatever it is. And you can be a real person and be in academia. And you also can have, you know, a psychiatrist and be in academia, and that's okay to say. So those are all things that I think are really important. And what reinforces that are when like my fellows will come to me privately and be like, I'm having trouble, or I'm, you know, this and that. And I can't tell you how many times that's happened, or residents. And I feel really good when I can be there for them in my own institution. At first I felt really weird, like, oh God, you're following me. But now I know that's, you know, that's why, is that, you know, so I can be of service in that way. And then
I just have to say real quick is that there was a recent topic about this on Clubhouse, which is another social media platform, about women. I know.
I can't keep up.
I just want to basically thread in this point where there was a discussion, there was a question that was asked about why, and I think there's a few studies about this, about why there aren't a lot of, you know, advanced academic physicians who are women, and like the hurdles that women in academics specifically struggle with, whether, you know, and when it's comparing apples to apples in regards to the amount of research, the type of research, you know, all of the research review by the committees at your institutions. Why is academic advancement not at par for women as compared to men? And I think, you know, just again, seeing somebody on social media that is doing it, we say this all the time, representation matters. And so, you know, that message goes along with this very, you know, recent topic about, you know, women can do it and they can advance. Obviously, there's issues in the systems that we have to deal with, but we're not going to go away. And if we want to do what we want to do and we want to work up that system, we're going to do it. So I just had to thread that in and say,
I mean, gosh, and oh God, I mean, I've given talks on this. I could talk for hours about why that is the case. But exactly what you said, like, first of all, representation matters. And I had examples of that in my real life. And frankly, if we don't push through those barriers, it will truly never get better. And I never wanted to, like, I was always happy being like a worker and like doing my research, putting my head down. I never wanted to be like a division chief or blah, blah, blah. And now I'm like, I have to, you know, Embry, we were on that talk, like, now I'm like, I have to do that, because if I don't do that, women behind me are not, like, that's why we're not getting ahead, is because women are not in leadership. Like in my own hospital, there are so few women in leadership, like one or two. So anyways, but again, I won't go off on that tangent because gosh, I could talk for hours about that. And you asked like, what do I think about trainees on social media? I think, first of all, that's such a hard question, because I do think that they should be on social media. I think it's important to find, like, you can find mentors, you can make connections. You know, I do think, unfortunately, the flip side is also that there does need to be a certain level of, I hate to say the word professionality, but sadly, I think it's more just awareness that people can see you, right? And that everything you put out there is permanent. Again, it's not to say you shouldn't be yourself, and because you absolutely should be. But like, you know, with anything, like, I won't put something that's like, I think being honest and being unprofessional are often two different things. Like being honest about having past history of like mental health struggles versus like posting you saying something inappropriate, you know, something like that are two very different things, right? So I think just having that level of awareness that someone can see what you're posting. And then also, I think this is the part that actually is a personal thing that I think is becoming a problem is the HIPAA issues. I think people's understanding of what that is unfortunately lacking. And for our generation, like the three of us, it was so ingrained in us, like, don't talk about patients, not even in like a vague way, definitely never in, you know, in a way that can, a time identifying way, you know, things like that. And I see trainees all the time posting like snapshots of the EMR and labs and in real time saying like, oh, I just admitted a COVID, especially in the COVID era, right? Like I just admitted a COVID patient and lined them up. And I'm like, guys, that's actually a HIPAA breach. If you say it in real time, if you say at the end, you know, a week later, like I took care of COVID patients, that's obviously not a HIPAA breach. But to say in real time those kind of things, if a patient's family is just remember this, if a patient's family can identify, you know, from your story that's their family member, then that's a HIPAA breach, right? So I think having that level, you know, we all want to dump after we have a hard day. But I think one of the best pieces of advice that I've heard someone say is just let it sit with you, talk to a friend in person, talk to a colleague, talk to like a family member, and a week later, then you can reflect on it in a way that has no identifying information. I just think it's hard to do that in real time in a way that's not going to be. So I just think there needs to be a level of accountability when it comes to that. So that's what I would say. I do think that there's a great role for it. And I truly, you know, have made connections with younger trainees. And I think that there is such an incredible role. And I wish I had been on social media. I wish this had been available to me when I was younger, honestly. I think it's wonderful. And I think there are so many benefits to it that far outweigh the risks. You just need to know what those risks are.
Yeah. Totally. And I mean, Amisha and I talk about this all the time and with so many people that this would have been such a great tool when we were in medical school and training, you know what I mean? To be able to, I think one of the coolest things is, you know, not only on Instagram, but also on Twitter, being able to have access to these like brilliant minds, literally by just sending like a DM, you know, and just saying like, hey, like I remember I did that to Martha Galati, who's like, in cardiology. When I first joined Twitter, and I didn't even know what I was doing, but I was like, oh, I wonder if she's going to read my message. And so I was a fangirl of hers, and I messaged her, and I totally wasn't expecting a response. And then the next thing you knew, she welcomed me to the world of women in cardiology with like all of these like other people. And I was like,
amazing.
This is so cool. Like,
that's amazing.
I can do this. And, you know, and that led to Amisha and I being able to talk to her later and, you know, other opportunities. And so I think just like you said, like social media has so many great advantages for us, especially for students and trainees.
Oh gosh,
to also be able to utilize it in a responsible way, because again, at the end of the day, when you're putting stuff out there, it's out there. And we know plenty examples, even people that we all probably mutually know that have gotten affected in a negative way, even though they're far out in their career and thought they were being responsible. You know, there's always someone who's out there to try to bring people down to another type of, you know, topic. So, and we also love looking at pictures and stories of your cute baby. The things that you post about her and your life with her. I think it's so heartwarming because it also shows a different side of you, you know, that you're not only, you know, this badass like physician scientist, like killing it, you know, in academia and research, but then you're also a mom and you're a wife and you dedicate your time to that too. And you're showing people you're literally showing them that you can do it all. And I think that, you know, like we keep on bringing up, like representation matters, and, you know, showing people that, you know, you can do it all. You're the example of that, you know, and I hope that you continue to do that and you continue to show that and encourage other people behind you, you know, that anything is possible. I really hope that you become like division chief or, you know.
That would be amazing.
Do it. We are rooting behind
I'll
you.
vote on that committee.
Are amazing.
Take over. We'll be your campaign manager. So we will.
You need a letter? I'll do the letter.
We enjoy talking to you so much.
Oh, I love you guys. Thank you.
Yeah, it was so fun. And so, do you have any lasting words for our audience before we have to go?
I think my lasting words are, use social media to make real connections. Like, because again, like I wouldn't have known you guys, and I think that that's the power of social media. And I can't minimize that, because I feel like, as you just said, like you get real opportunities in life because of that. And beyond just opportunities, you have human connection. And as I told you, I got on social media because at the time I had no friends where I lived. And actually, I didn't mention this, but like besides like one or two coworkers, my closest friends in DC are from social media. Saya, Anjali, Tara, like they are all my closest friends in DC. Like I saw them this weekend. So you can make real friends. And I literally, like, I always joke with them. I'm like, guys, we're friends because I asked you both on dates. Like I just was like we were talking and I was like, oh, you're in DC? Like, let's hang out. So don't, just put yourself out there. That's how about that? That's my like lasting word, is put yourself out there, just like you did with Martha Gulati. Like you have nothing to lose. If they say no, they say no, it's fine.
Yeah. And if they say yes, you never know. The possibilities are endless. Put yourself out there, but do it in a responsible way.
Yeah, that's a good life lesson.
Yes.
Oh my God, we had the best time. I really hope that we get to meet in person soon.
Yes, we do.
Grab a little drink and do like a happy hour. I feel like we would have the best time.
We would. This was really, I'm so glad we did this. And I'm so sorry I was so delayed.
I'm sorry that I was delayed. I was taking a little snoozer. Sorry.
You know what? We all got a snooze.
Real life chronicles of what happens in medicine. You get tired.
Exactly.
Again, thank you so much for joining us. And thank you to
guys.
our audience for joining us this evening. And we hope to see you guys back on another episode of Heart to Heart. Bye, everybody.
Bye.